Types of people who should not follow the keto diet. A keto diet or low-carb, high-fat (LCHF) diet, as the name implies, is highly low in carbohydrates. The human body relies mostly on glucose as a combustible. In highly low-carb diets, the body tends to break down the accumulated fat and the body itself. Experts believe that it is not the time for breastfeeding to try to lose weight. You develop a human, after all, particularly by adopting the keto diet. Why is this so? The cutting off of whole classes of food is incredibly difficult, says diet specialist Frances Largeman Roth, RDN, the writer of Feed the Belly, to receive all the nutrients necessary for a healthy child. The necessary nutrients for a baby. That this diet is not ideal for persons with any level of diabetes, renal or pre-existing liver, pancreas, or kidney complications. Certain unusual conditions such as muscular dystrophy and other diseases can make the pancreas, liver, or kidneys more complex and difficult. Diet plans, such as the keto diet, are famously impossible to conform to. It's not easy to follow, and people don't learn how to eat a well-balanced, varied diet, said Largeman Roth. If you have dieted a crash and losing weight in previous years, it might not be the easiest. By subscribing to these terms and conditions, you claim, with the consent of your physician, that you do not have any of the aforementioned medical conditions.
Diets low in carbohydrates are often typically low in fiber. But, according to National Health Institutes, having enough roughness can be critical whether you struggle with irritable bowel syndrome or chronic constipation. Most people need 25 to 35 grams fiber every day, but a licensed nutritionist will help you find out how far your digestive problem is right. The nutritionist Martha McKittrick, Rhode, said, adequate fibers were also critical for the health of the gut microbiome. One of the keto diet's concerns is that low fiber and high fat levels could adversely affect the microbiome.
Nursing is therefore not a good time to lose weight. People breastfeeding require more calories currently than women pregnant, and a reduction in the consumption can be harmful, says Largeman Roth. Your water requirements are typically higher during breastfeeding. And because the keto diet cut out foods with a rich water content like fruits and some veggies, you may be more likely to dehydrate, says Largeman Roth. Experts suggest that you take a glass. The keto diet is generally perfect as long as there are certain health advantages of it, but not all specialists or health providers recommend the keto diet or ketogenic diet for patients because each has varying body metabolism and different responses to specific food doses. Those with outdated illness or severe health problems, feeding conditions, lethargy, skin allergies, allergy to certain dietary ingredients, people needing a certain gram of carbohydrate, that is more than the optimal gram of carbohydrates in keto, should avoid giving the diet. There is also a chance of modifying the prescriptions easily when on this diet. You will also have to. It is important to talk with your doctor or endocrinologist if you consider ketogenic diet, especially if you have a medical condition, to formulate a plan. If you are on a low blood sugar diabetic, these medicines may have to be adjusted in a few days, Condon said. It's cardiovascular fat, but if you're not trained in cardiovascular fat sources, you may consume excessive amounts of saturated fat that may increase your risk of heart disease, says Condon. Keto diet can cause low blood pressure, kidney stones, constipation, deficiencies in nutrients, and an increased risk of cardiac disease. Strict diets such as keto can also induce social alienation.